Hi, this is Bonnie Schmidt, and I'm happy to be working with you again as your adult health theory instructor. I'm excited for you as you continue your journey through med-surg content and into your first precepted clinicals. At this point, students usually have lots of questions about how the two courses are going to work together. And hopefully by the end of this recording, you'll see how the two can do that and how theory is designed to work around your clinical schedules. Brent will be talking later about how clinical works, but I just wanted to let you know some things about theory. One thing you'll be happy to know is that the modules are generally 3 to 4 days in length. And there's one very small module, the burn module, that's 2 days long, and one that's 5 days long, but the rest of them are 3 to 4 days in length. That means that the reading and the content postings will be deadlines will be slowed down a little bit. The other thing you'll be happy to learn is that there are no discussions in adult health 2. Now, this may not be true of all theory courses with clinical, but I believe that in your first precepted clinicals, you shouldn't have to worry about clustering, about making multiple postings throughout the duration of the module. And what I do is I assign one content question, and then the other one I consider a wildcard content question where you add information or a clinical example to the posting of another. Another thing that you should know is that in theory courses that are associated with the clinical, you have a 36-hour window to take any quizzes or exams. The quizzes and exams start at 12 noon and then end at midnight the next day. So this gives you an opportunity to take these exams around your clinical scheduled shifts. Now, that's the good news. But that being said, there are some things that you should know to keep on your toes about adult health 2 theory. First of all, it's a lot of reading. And we have a lot of conditions and a lot of nursing care, a lot of diseases to study yet in the Lewis textbook and nutrition in the Rodner textbook. And you'll need to pay attention to deadlines and use your time wisely around your clinical so that you don't get behind. One tip that I can give you is that if you have a day where you don't have clinical, to focus on your reading that day so that you stay ahead, or at least at where you should be at the assigned readings for the module. Another tip is that try to do something after a 12-hour, or after your clinical, or before your clinical, depending on what you're scheduled for, even if it's just reading your postings. And I know we talked about that a little bit during your online pre-admission interview, or your phone admission interview. A word about scheduling your clinical shifts. Do not schedule clinical around theory quizzes and exams. Rather, these are designed to work around your clinical schedule. Your preceptor should determine your clinical schedule, not you. Even if you have a full-time preceptor and don't need to work all the hours that they work, the preceptor still has the right to say which of their shifts would work best for them and for you for your learning. It is not acceptable for you to say you're not available to work on Friday because you have a theory exam. Now, that being said, some of you will have a couple of 12-hour shifts in a row, depending on your preceptor schedule. If your clinical shifts fall on both days of a theory exam, please let me know and I will grant you an extension into the next day. I do believe that you might not be, because you're tired, you might not be able to perform as well as you would like on theories and exams, especially after those 12-hour shifts. Lastly, if you have any questions or concerns about theory, please let me know. I am there for you. And next, I'd like to turn it over to Don Pope to talk about preceptor vitas and chats.
Okay, I know everybody's excited to get back into the clinical. You had a little taste of it while you were here during boot camp, But now it's like you will be in the real world with practicing nurses in various units. There are some responsibilities that you will have for every clinical. Let me just say how the clinicals are set up as far as who you are responsible to report to during clinicals. There's 3 people that are involved in each clinical. Each clinical has a course coordinator, which is either Bonnie, Brent, or myself. And you will know who that course coordinator is when the course opens up. And there is an introductory welcome hello from that coordinator. That person is responsible for making sure that the course is all set up and ready to go. For monitoring that chats have schedules set up, and as a resource for other instructors, especially distance instructors, as well as preceptors, and lastly also to the students, if there is a course issue. You are also responsible primarily to your instructor. Your clinical instructor will be listed in the content area of the course, so you will know who your clinical instructor is. For those of you who are from out of state, you will have the same clinical instructor for every course. For those of you in state, you will have a different instructor for most clinical courses. And then you also have your preceptor who you need to communicate with. And as Bonnie said, you work with your preceptor to arrange your schedule. So that being said, the 2 things that I'm going to talk about in relation to clinicals that you will have to do for every clinical are Vitas and chats. First, your Vita. The purpose of the Vita is twofold. One of the reasons is that for accreditation, we need to keep on file some information on every preceptor that works one-on-one with one of our students. But secondly, and most importantly, it's to help you interview your preceptor to have a good understanding of who your preceptor is professionally, what their background is, what level of schooling they have, and just get to know that person a little bit better. Showing interest in the person, asking questions about what they've done professionally really helps you get off on the right foot when forming a relationship with that preceptor. The Vitas are done early in the clinical. They're usually due within the first week. The form to follow with the information on what type of information you'd want to ask your preceptor will be found in every course. But that being said, the purpose of the form is as a guide for you for your interview. It is definitely not to be handed to the preceptor and ask the preceptor to fill it out. It is for you to have a conversation with the preceptor, showing interest in their background, their professional background. Once you get the information, transfer it to the form that's available in the course. You then email it to Becky Lemire, and then she forwards it to the course coordinator, who actually puts the grade in. The grade for the Vita is a pass-fail. We just need to make sure that it's done. The only time you would not have to do a Vita for each clinical is if you have a preceptor for more than one clinical. Say you have the same preceptor for Adult Health 2 and Aging. When you got to the Aging course, you would not have to put down that same information again, but just rather drop a note to Becky saying, I have the same preceptor as I had in Adult Health 2, and you're good to go, and you'll get a pass grade for that. The second thing that you do for every clinical is to participate in chats. And chats, the purpose of the chat is to be like a post-clinical conference that you would do if you were like a traditional student where you had 7 to 10 students in a section and you were all at clinical at the same time. You end those clinical shifts by sitting down and discussing what went on, how that shift went, much like you did in boot camp following your clinicals. Because we do not have the opportunity to do that, we have chats online in Second Life. So we have a virtual connection in Second Life, discussing our clinical experiences, putting those experiences together with theory, etc., etc. You will each have one faculty member that will facilitate that chat. It does not necessarily have to be your clinical instructor. What happens is there are several time slots that are put into the discussion area, and then you sign up for a time to attend a chat based on your clinical schedule. You want to sign up as early as you can so that you can sign up for a chat that is not on a day that you're already signed up for clinical. There are a limited number of seats in each clinical, so if you would get to the point where there are 4 chats, you are working 3 of those days, you need to be in that 4th chat that's on the day that you don't have clinical. Well, there's already 7 students signed up, and that's all that can be in that chat. Your first option would then be to contact the other students that have already signed up for that chat and ask for one of them to switch. Remember that where you are signed up for chats are based on everybody's clinical schedules, not on your personal schedules. So if you get a request from somebody and you have the option of switching to another shift or another chat, and that's the only session that the person asking for the switch can attend, then it is up to you, your responsibility, to make that switch with that person. The other situation that may happen is you may be scheduled for every session, you may be scheduled for a clinical shift. In that case, you'd want to touch base with your instructor as soon as possible to see what we can do about it. Some of the things that can be done in those is if you're working 12-hour shifts, you might only work an 8-hour shift on that day, if it's okay with your preceptor. The other possibility is if your preceptor works more shifts than what you absolutely need to get your hours in, you can switch to a different day that your preceptor is working that you aren't already scheduled. There are a lot of other options, and your clinical instructor would be there to help you troubleshoot, figure out what you can do to make the chat. If they have a problem helping you figure it out, and oftentimes the distance instructors don't have quite the same understanding of chats, then they contact the course coordinator, and we all work together and we make it work for you. So that's 2 of the things that I'm talking about today, the Vitas and the chats, and now Brent's going to talk about other clinical issues that you will encounter during not only this first Adult Health 2 clinical, but all of the clinicals.
Hi, and welcome back, and it's great to chat with you again. You're finally going to be heading back into the clinical setting, and I'm sure you're all very excited to get back into the clinical role. And for this first clinical, I'm going to be the coordinator, as Dawn had highlighted. Each of us, that's a revolving door, who's the coordinator. As Bonnie highlighted, this is the first time managing clinical concurrent with a theory course. Can be a bit intimidating, but if you plan ahead and manage your clinical shifts along with your theory commitments, you'll do just fine. But you're really going to have to challenge some of your study skills and find a way of establishing a new norm, a new equal, where you have to balance both of those. Some people find that to be a challenge, and make sure that you're talking with your advisor or Bonnie or myself or your clinical instructor along the way until you get oriented. Some people can feel really overwhelmed, so just be cognizant of that. I want to talk about the skills checklist. If you remember the skills checklist, that is used in boot camp to keep track of your skills. Remember to keep it with you and to document when you've completed a skill. It's great for future clinicals to let your preceptor know what you've already done, and also as a good work reference tool. Sometimes in the past we've had students that have, when they've said, well, what have you done in clinical, and why were your clinical so high quality besides being precepted, you can actually show them evidence of what you've done. I think it helps students to be confident in remembering all the things they have done, and provides documentation of that work getting finished. So make sure that you have your skills checklist up to date and with you. When you've contacted your preceptor and you know his or her schedule, try to arrange a clinical schedule for yourself with input from your preceptor that will meet your learning needs. And your instructor should be close by. If you run into a snag doing that, or you've got other mitigating circumstances. Make sure that you can consult your instructor if it doesn't lay out as ideally as you'd like. Ideally you'd be to schedule your hours for 112 hours for this clinical evenly over the weeks of clinical, and you have 5 weeks. So approximately 20 to 24 hours per week with your preceptor. It's not always possible. That's what I was talking about earlier. When you have vacations or in-services or other assignments, make sure that your instructor's in the loop if you're going to have some lopsided hours, because they can help you strategize on how to work with your preceptor to make that the best possible learning environment. One thing you do not want to do under any circumstance is to front load your hours. I know you're all overachievers and you're like, boy, if I could get my hours in, I'd have more time for theory, and that does not work at all. And as Bonnie will attest, all it does is put you behind in theory, and then you're feeling like you're behind. And, also your theory that you learn is going to inform your practice. So an even pace is critical. So just be cognizant of that. Really try to stay at that 20, 24 hours per week pace. So the practicality of that, and Bonnie's mentioned this a little bit, touched on this already, is no more than 12 hours scheduled per day or more than 40 hours per week. If you have to stay more than 12 hours to finish work in progress, that's fine. But staying with your preceptor for an extra half a shift, and they ask you to, you just have to tell them no. Like an extra 4-hour shift, you're not doing that. 12 to 16 hours, if you got somebody who's really experienced, it's all they can do to make sure that their practice doesn't suffer. But for a student, 16 hours, 12 hours is pushing it. 16 hours is just, you're not learning anything. And then, and also remember you must provide your instructor with your schedule and notify him or her of any changes. They have to know when you're in the clinical setting, period. No surprises. I always give the example of a call that I got one time when I was a clinical instructor, and it was a surgery, an OR nurse calling me and telling me that my student had passed out in surgery and that they were okay and everything was fine, and I didn't even know they were in surgery. So stop for a second and pause and think how that went. Not good. So you have to know when you're in the clinical setting, your instructor does. Notify your instructor immediately of any problems or incidents, like a fall or a needle stick. No studying at the clinical site. It's a deal killer. If you're doing nothing, you're doing something wrong. And please come to clinical well rested and take a break for lunch. It'll aid in your learning. And make sure that you contact Bonnie with theory questions, and your clinical instructor, then me with clinical questions. And the lastly is remember to stay flexible when it comes to your placement. Tom and Lori will let you know about where you're going to be placed with a preceptor, and they place thousands of students and they'll get it done, but when they're interrupted with questions, it affects their ability to move forward. We have 2 or 3 clinicals going on at the same time, and I can't emphasize how important it is when we're doing so many clinical placements that Tom and Lori are left to do their job. They will let you know, believe me, they take great pleasure in seeing that everybody's got their clinical placements and everybody's got their preceptors. So with that, good luck and have fun. Come on, this is what you've been waiting for, is to head back into clinical. So, pace yourselves, get out there and apply what you're learning in theory class and practice, and everything you picked up in boot camp, and it's time for the last push to the finish line. So good luck, and we'll talk soon.